Have you ever heard of ROP, retinopathy of prematurity? In this video, we're going to be talking about what ROP is, or retinopathy of prematurity, how it impacts a very young patient's eyes, and some things that the parents or the guardians or whoever's watching over the child will need to be aware of as diagnoses in these conditions and the physicians will talk to you about. So, retinopathy of prematurity, by a basic definition, is what happens when the retina does not fully form in prematurely born infants or in infants, little babies less than 3 pounds typically. The retina hasn't fully developed. The blood vessels may have not fully gotten to where they needed to. The retina may have not sealed up. There could be some retinal detachments that may have occurred. And usually this can impact the baby's vision significantly as far as what they're able to see, where they're able to look, how they're able to try to visualize faces, anything like that. And usually PICU, NICU, the nurses and the physicians watch this usually really carefully when the baby's born, just to make sure that things are starting to develop normally and progress normally, and if there's any surgeries that are needed, because a lot of ROP babies or patients will need some level of retinal surgery in order to kind of fix the retina or get the blood vessels in the right position. But honestly, I've seen quite a few ROP patients that have gone on to have very normal lives once the issues have been corrected at hand, when they are correctable. The diagnosis itself can be a little bit scarier than what it's made out to be. It's just the retina needs to develop a little further, and they will develop the retina in time. It's just they need a little bit of help on the front end whenever they're born a little bit early, in order to be able to get the best help to see their best, as well as have the binocular vision system develop appropriately and correctly. And there are different stages and different categories and different types of ROP, which you can look up on the internet or consult your local eye doctor. Or if you have any questions, to ask the physicians that are monitoring your baby or babies that may have this condition, just because they're going to be very familiar with those stages and they can tell you exactly where your little one is at this time. And that's how it can impact the patient's vision, especially when they're that young and they can't really tell you what's going on. They can't tell you, like, I can't see far away, I'm missing some vision, anything like that. It's usually a very objective based examination to determine if there's impacted vision, or things that are going wrong with the vision, or things that need to developmentally need to be corrected in order to continue the healthy developmental process of sight, vision, and binocular vision development. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.